Hello, my name is Barb, and the topic that I'm going to be presenting today is secondary stroke prevention. This is part of a series of education classes that we provide to patients who are admitted to our hospital and for their family members. So today I basically have two objectives I'm going to be covering over the next little while. The first objective is just to discuss what secondary stroke prevention is. And then secondly, we will be discussing some of the medications that are more commonly used for secondary stroke prevention. In particularly, we'll be focusing mainly on the two classifications of high blood pressure medications, as well as the medications used to address the cholesterol and anti-platelet medications. Secondary stroke prevention is basically a clinical focus that is individualized to the person who has just sustained having either a stroke or a TIA. So the focus is really looking at how can we reduce having a second event. This is done mainly through trying to identify and treat the underlying cause of that TIA or stroke. We do this by doing a number of investigations, and as a result of those investigations, if we find that the person perhaps has a narrowed artery in the front of their neck, known as the carotid artery, then we would send them to see a vascular surgeon to determine if they would be a candidate to have surgery done to fix that narrowed spot. Another option would be if the person was identified as having an irregular type of a heart rate, such as atrial fibrillation, then we would look at putting them on the appropriate medication to address that. The other big element of secondary stroke prevention is also looking at trying to identify the potential risk factors and then treating those risk factors. And that's where lifestyle modification strategies come into place, as well as any medications. So when it comes to the healthy lifestyle choices, one of the things that we like to try to address with people is looking at their diet. In general, the key principles that we like to share with individuals is to encourage them to have a low salt or not adding any extra salt to their diet, looking at the amount of fat that they may consume in their diet and helping them to choose more healthier lifestyle or dietary choices. As well, it looks at focusing on the portion sizes. Another element of healthy lifestyle choices is trying to encourage more physical activity. The best practice guidelines actually recommend that we should be trying to aim for 150 minutes of exercise in a week, and that can be broken down into 30 minutes at a time or 10 minutes at a time. And the type of exercise that we like to encourage people to do is one that really makes their heart rate go a little bit faster. So something that is done at a moderate intensity, such as brisk walk, swimming, jogging. In addition to the exercise, we also like to focus on a person's weight, and if they have a healthy weight. There are two measurements that we can use to determine if a person has a healthy weight. One is called a body mass index, and this is a ratio of the height to the person's weight. The normal body mass index falls within a range of 18.9 to 24.9. A more accurate way, though, of looking at whether a person has a healthy weight is actually looking now at their waist measurement. And the new best practice guidelines that were just recently released from the Canadian Stroke Network, they have now adopted the World Health Organization's measurements for doing waist circumference. For women, the cutoff is 80 centimeters, and for men, the cutoff is 94 centimeters. And where you want to measure is at the belly button or at the navel region. In addition, we look at how people can best manage their stress as a way to further reduce perhaps their blood pressure, as well as how their glucose levels may be. In addition, we also like to encourage people to quit smoking, and there are different strategies that we discuss that will better help people to choose a non-smoking lifestyle. And another option as well is to looking at the alcohol consumption. What is recommended for men is no more than 2 drinks per day, and for women, no more than 1 drink per day. And if a person doesn't drink alcohol, then that's ideal. But if they do, then there are limitations. And when we refer to a drink, what we are referring to would be the equivalent of a bottle of beer, or a 5-ounce glass of wine, or 1.5 ounces of some type of a spirit. And I know in previous presentations, there's more emphasis placed on the healthy lifestyle choices, so this is just really a summary at a high level. So when it comes to the medications, the antiplatelet medications are one of the key ones that are prescribed for people after they've had a TIA or a stroke. And the first choice that we recommend is prescribing aspirin, either 81 milligrams or 325 milligrams once a day. Different studies have been done that have been shown that the 81 milligrams is just as effective as any of the larger doses, and there tends to be fewer side effects. So the 81 milligrams usually is the first choice that we put people on. If the person has an allergy to aspirin, then we are limited to prescribing Plavix for them. Or if the person was already on aspirin at the time that they had their TIA or stroke, then the options are Agranox or Plavix. Basically, all 3 of those medications work on preventing the platelets, which are an element within our bloods that play a role in clotting, to not stick together or to form clumps. They all work on different mechanisms, but the end is just to prevent blood clots from developing. When it comes to the side effects with aspirin, the main side effects tend to be more related to the gastrointestinal system, such as having nausea, heartburn, or stomach pain. Another potential side effect, which tends to be more that develops after prolonged use, is tinnitus, or ringing in the ears, and some people may also develop bleeding problems. With the Agranox, one of the main complaints that people have after starting to take it is a headache. As well, they can develop stomach pain, heartburn, or nausea, and in some cases people may also develop diarrhea when they take this medication. With Plavix, the main complaints that people have for this one, in addition to having maybe an upset stomach, is they can have nosebleeds, bruising, there may be some itching or also bleeding. So when it comes to any of those 3 medications, some of the strategies that we recommend to people to try to help them to maybe minimize some of those side effects is if to take it with food. It actually helps them with digesting or having the medications breaking down and not causing issues with their stomach. It's also very important to not miss a dose, because these medications, if you miss a few doses, they start to wear out of your are no longer in your system, and then they're no longer going to be effective. And after having had a stroke or a TIA, we really want to try to minimize the risk of another one happening. It also is important to not chew the medication, but just to swallow them whole with water. Because these 3 medications all have an impact on the functioning of the platelets, it is important to be careful to avoid injury, because there can be an increased risk of bleeding. So we recommend people using a soft toothbrush when coming to brushing their teeth, so that they may not have any bleeding in the gums, or using an electric razor as opposed to a straight razor in case they nick themselves while shaving. And it's also important, if at any time you have any questions regarding any of the medications that you've been put on, to speak to your doctor, the pharmacist, or the nurse with your questions, so that they can better help you. The other key element when it comes to trying to assist in lowering the risk of another stroke or a TIA is hypertension management. The goal of antihypertensive treatment or lowering people's blood pressure is ideally we want the person's blood pressure to be less than 140/90. If the person has diabetes or kidney disease, then the goal is to have their blood pressure to be less than 130/80. One of the major groups of blood pressure medications that are often prescribed for people who have a TIA or stroke are those that fall under the angiotensin converting enzyme inhibitors. Through various studies, again, we have found that this particular classification of blood pressure lowering medications have been really beneficial in helping to lower the risk of another event. And so this is one of the main groups of blood pressure pills that we like to prescribe for people to give them better protection. And basically, one of the two more common ones within this group that are prescribed is Altase and Coversil. And basically what these medications do is they just help the artery walls to be relaxed. They do this by working in the kidneys and blocking an enzyme that converts angiotensin 1 to angiotensin 2. And angiotensin 2 is an enzyme within the kidneys that is considered to be a very powerful vasoconstrictor, meaning that it causes the artery walls to tighten. As well, these medications limit or inhibit the breakdown of another substance known as bradykinin, which is used to help to dilate or to expand the vessel walls, and that's really what we want to happen. And it takes, once this enzyme is limited by about 90%, that's when we're really going to see the maximum effect that these medications can have. So if you think about what high blood pressure is, it's really that force against the artery wall. And over time, what the high blood pressure can do is cause the artery wall to lose the ability to stretch. And that just makes the whole process of hardening of the arteries or atherosclerosis from developing. In addition, that pressure against the artery wall can cause little micro tears to develop within the lining of the arteries, which also then kickstarts this whole process of atherosclerosis developing. So the better we are at trying to address blood pressure and keeping those arteries more healthy and more relaxed, the lower the risk is of having any further problems. Some of the side effects that are more common with the ACE inhibitors is that persistent dry cough. Often a lot of people will complain about this. If it's really quite bothersome or affecting a person's ability to sleep at night, then we need to be notified of that so that we can switch the medication to a different type. Another side effect that can be very worrisome is one that's referred to as angioedema, which is swelling that can occur around the lips, the tongues, the hands, or in the groin area. If this should happen, the medication needs to be stopped immediately and your physician notified. As well, some people can develop dizziness when they take this medication, so often it's given at nighttime so that when the medication is really more working at the best, the person will be sleeping and hopefully won't experience the dizziness. It also can cause kidney functions to worsen and can raise serum potassium levels, which then can affect how our heart functions. So in order to monitor for that, it's really important that potassium levels and kidney function tests be done within about a month of starting this medication to make sure that blood test levels are not increasing. If the levels are increasing and increasing by more than 25%, then that's the time that the medication needs to be stopped and switched to a different type. And again, just to repeat myself, it is very important that if you do have any questions or concerns, to please always speak to your doctor, the pharmacist, or the nurse. The other major classification of blood pressure medications that we like people to be on if they can't tolerate the ACE inhibitors or if there's a reason why they're not allowed to be on the ACE inhibitors, then we like to try them on an angiotensin receptor blockers, which are known as ARBs. And some examples are Cozar, Diovan, Adecan, or Macardis. Basically, these medications work similar to the ACE inhibitors in that they help to prevent that angiotensin 2, which is that vasoconstrictor, from binding to certain cells within the walls of the blood vessels, and then by doing that it helps the artery walls to be more relaxed, and then that's what brings your blood pressure down. Again, the ARBs do not have the same degree of side effects as the ACE inhibitors do. However, angioedema is one of the ones that we do need to monitor for. In addition, they also can cause potassium levels to increase. So similar to the ACE inhibitors, blood work does need to be drawn within a month of being on these medications to make sure that there's no changes happening to the kidney functions, as well as people who do have kidney disease or liver problems. We really need to monitor them more closely. And again, if you have any questions, always speak to the doctor, the pharmacist, or the nurse. In general, when it comes to the blood pressure medications, it can take up to 6 weeks before the medications are really working effectively at lowering your blood pressure. It's also important to take the medications regularly and not to miss any doses. Unfortunately, when it comes to the blood pressure, there really is no cure for it. The only thing that we can do is really try to control it. And if we miss taking the pills, then as soon as you stop taking them, the blood pressure will start to sneak back up again. So these pills are often prescribed for life unless your doctor changes the medication or stops the medications. The other group of medications that we'll be talking about now are related to cholesterol. The cholesterol is one of the large risk factors for strokes or for warning the TIAs. And so it's important that we monitor cholesterol levels and then treat them aggressively. So when it comes to trying to address the cholesterol, ideally we want the bad cholesterol, which is referred to as the LDL, to be at 2 millimoles per liter or less, or to have a 50% reduction of what the cholesterol level is at baseline. And prior to starting any cholesterol lowering medication, the levels should be drawn initially to give us an idea where the levels are at. And then also we need to monitor the liver enzymes and another blood test called the CK level, which focuses on how people's muscles are functioning. The thyroid stimulating hormone and glucose levels also should be monitored prior to starting any cholesterol lowering medication. One of the major groups of cholesterol lowering medications that are often prescribed are those called the statins. And the one that's most common is Lipitor, but also Zocor and Crestor, and there are many others that can be prescribed. Basically, these pills work on your liver to slow down the production or stop the production of cholesterol. Cholesterol is a natural substance that our liver is always producing, but in some cases, more people have higher levels than others, and so the statin drugs work on the liver to slow down this production. And as a result of that, the bad cholesterol, or the LDL, is decreased anywhere from 18 to 55%, and our good cholesterol, the HDL, is actually increased by 5 to 15%, and the triglyceride levels can also be decreased by 7 to 30%. And that's really the goal. We want the bad one to be as low as we can get it, the good one to be higher, and the triglycerides to be lower. Now, a number of people have often heard of some of the side effects of the statin drugs, and a lot of people are quite nervous to go on it. There are 3 in particular that are quite worrisome. But fortunately, they do not happen very often. The risk of them is really quite low, and by monitoring blood work, we can actually help to limit the major side effects from happening. But the the first three listed on this slide are the ones that people are quite concerned about. So there's the myalgia, which is the muscle pain that can occur. Predominantly it's in the larger muscles, so the muscles within the abdomen or in the upper part of your legs, or the thigh muscles, or in the upper part of the arms. The other one is myositis, which is an inflammation of the muscles, which can also contribute to the pain, and rhabdomyolysis, which is known as the breakdown of the muscles. And those are the three that we really want to try to limit. Some people also can develop headaches when they start taking the statin drugs, or they can get stomach pain and nausea. So in order to try to minimize those risk factors, after a person is prescribed a statin drug, the cholesterol levels, the liver enzymes, and the CK levels should be checked at 6 weeks, and then again at 12 weeks, and then anytime the dosage is changed. They should be continued to be monitored at least every 6 to 12 months until the levels normalize and the person does not have any of the symptoms suggesting a side effects. In addition, when you're on a statin medication, it's very important to not take grapefruit juice, as this can increase the strength or the potency of how these medications work. The exception is with pravastatin. Also, if you develop any kind of muscle pain or soreness or weakness in your muscles, please speak to your doctor or the nurse or pharmacist so that they can advise you on how to address that. If, for instance, if those statin drugs are not helping, or if you do develop any of the side effects related to it, there are some other types of medications that can be prescribed. One of them is called a bile acid resin, and another type is called a cholesterol absorption inhibitors. These medications work more within the intestines in helping to decrease the absorption of cholesterol and the decreasing the amount that is returned back to the liver from the intestines. By doing this, they will help to lower the bad cholesterol anywhere from 15 to 30%. So they're not quite as effective as the statin drugs, but they do help. They can also increase our good cholesterol, or the HDL, by 3 to 5%. And in some cases, they can actually make our triglyceride levels go up, which is really not what we want to happen. So these particular medications are not the first choice. The statin drugs are our first choice. Some of the side effects that are more common with these two particular groups of cholesterol-lowering medications are ones that are related more to the intestines because of how they work on the intestines. So some people may have an increase of feeling like they're bloating or having flatulence or feeling more gas. They may have abdominal pain or heartburn. They also can get either constipation or diarrhea and headache. And with the ezetrol, they can develop the muscle pain or weakness or the muscle breakdown if they're given in combination with the statin drug. So in that particular instance, those who are prescribed the ezetrol with the statin do need to be monitored a little bit more closely. With these two groups of medications, we don't need to monitor their liver enzymes or the CK levels like we do with the statin drugs. But we do need to be aware of if the person is on the combination of the ezetrol with a statin, then we do need to monitor those at that time. The bile resin medication should be taken with meals in order to help to lessen some of those side effects. As well, it's important to know that these medications can affect the absorption of other medications, and therefore they should be taken either an hour before or 4 hours after taking any other medications. Another group of medications that can be prescribed to help lower cholesterol, particularly if the triglyceride levels are quite elevated, is a group called Fibrates, and these are, again, are just some examples. The lipidil tends to be the one that you'll see more often, or the lopid. And basically they just lower triglyceride levels. They can make our HDL levels go up anywhere from 10 to 20%, and they can also lower the HDL, or the bad cholesterol, by 5 to 20%. However, the LDL can be increased by going on a fibrate, particularly if the triglyceride levels are really quite high. Some of the more common side effects that you may see with the fibrate medications are related to indigestion, nausea and vomiting, again, the flatulence or feeling bloated, the stomach pain, muscle weakness. In some cases, people are prescribed a fibrate in addition to a statin medication if the triglycerides are really quite elevated. And in that case, again, we need to monitor for any signs of muscle damage because there's an increased risk of this happening when this particular group of medication is given with a statin. So some of the safety measures in order to try to limit that is we do need to monitor the liver enzymes and also monitoring kidney functions to make sure that there's not going to be any increase with those side effects from developing. So basically, in summary, the medications that are prescribed are based on your specific needs. Often I'll hear people in the clinic, they'll talk to me about how their neighbor's on this medication or that medication for their blood pressure. And so I really just stress with people that the meds that we prescribe for them are specific to them to best help their needs. It's also very important that you understand why you're on the medications that you're taking. Again, from my experience, I've found that once people understand the reason for why they're on those pills and how those medications are going to help to lower the risk of having another event, they're more apt to want to stay on the medications. It's also important for people to understand and to know what to do if they have any problems with the medications that they are prescribed, because we really want to try to limit any further harm that can be provided. So if you do have any questions, please always speak to your doctor or pharmacist or the nursing staff, and they'll be able to help answer your questions. And it's also important to always keep a list of all of the medications that you're taking and carry this list with you. And on that list, it's important to include any over-counter medications such as vitamins or herbal supplements that you may be on, because some of those can interfere with the prescribed medications that you're on. And it's important for your healthcare providers to always know what you're taking.